diabetes, there are a lot of risk factors for diabetes. And for a lot of it, it's overweight or obesity does play probably one of the biggest roles. Family history also plays a very big role. If mom or dad had diabetes, that may be a reason that you may be diagnosed. However, there may be other risk factors that you're experiencing at the same time. So it's not just family history that may be your risk factor. It may be some of the other, like overweight or obesity, may play a role in it. Usually over the age of 45, but we're now seeing children who are diagnosed with type 2 diabetes, which used to be known as the diabetes over the age of 40. It used to be called the adult onset diabetes, but we're starting to see children diagnosed with diabetes, and it's because of overweight or obesity in children, and that's increasing that risk factors for type 2 diabetes in young children. There are type 1 we also see in young children, but type 2 we rarely saw in young children. Physical inactivity, that is a risk factor that can actually cause overweight or obesity and lead to overweight or obesity, but it can be a really big risk factor. Exercised muscles use insulin more efficiently. So those muscles that are toned use insulin more efficiently. And so whenever there are muscles that aren't very toned or that aren't used very often, then that can actually cause some of that insulin not to be used very well in the body. Sleep deprivation. All right, show of hands. No, I can't see it, but how many of you sleep 8 hours a day? Probably not very many of you are raising your hand, because a lot of us don't. We have a lot on our plates. We have a lot going on in our lives. Now you have a new diagnosis of diabetes. So there are things that go on in our mind constantly. Well, the lack of sleep can lead to overweight or obesity, which then can lead to diabetes. So sometimes for some of these, the sleep deprivation may not be an absolute direct cause of the diagnosis, though it can be a cause, because it does change some of the metabolic factors in the body that can lead to a diagnosis of type 2 diabetes. But usually it's a secondary factor. Obesity or overweight is the primary factor because it does increase inflammation in the body, which increases insulin resistance.
Julie, if my parents have diabetes, am I definitely going to get diabetes?
No, doesn't necessarily mean. It's not an absolute. It's a risk factor. You have a risk factor for it, but when you're taking care of yourself and you're eating healthfully and you're exercising well and you're sleeping pretty good and you're doing things in your life that are healthful, then that's going to decrease your risk. Doesn't mean you will never be diagnosed. Let's say you're 80 years of age. Okay, maybe mobility is an issue at 80 years of age. Maybe weight is an issue at 80 years of age. So there may be a higher risk factor at that age than it is now at, let's say, 50. So it can play a role, but it's not an absolute cause of diabetes.
Okay, great. I think it's a question lots of people ask themselves, right? You know, like, well, why did this happen? What if my parents didn't have diabetes and I didn't have that risk factor? You know, why me? And so as you're adding up all of these other risk factors to help understand, like, okay, you know, maybe I've just been feeling really sad and maybe that was part of this. So we can find out really some of the root causes. Sometimes it's easier to figure out the solutions, right, Julie?
It is. And a lot of times once we figure out what that root cause is, and that's why it's important sometimes to meet individually with a healthcare provider like a dietitian, for example, who can help you sort of find some of the reasons and then some ways that can help you to resolve some of those problems. Is it going to make diabetes go away? No, but it can certainly help you have a little bit better control of it.
Great. It's all about optimizing that healthy lifestyle, right? I want to get the most out of what I've got left.
Exactly. I call it a high quality life.
There you go.
I'm going to do everything I can to have a high quality of life. I have had a rather interesting medical history, and I've been diagnosed with cancer twice, two different types of cancer, and all while dealing with type 1 diabetes all at the same time. So it is fun,
There's that.
fun to have a lot of different risk factors that can increase other conditions. But as long as I am maintaining a healthy lifestyle, and look, I'm maintaining a healthy lifestyle and I'm still diagnosed with cancer. So doesn't mean I just have, it really means I have crazy DNA, but it doesn't mean that my lifestyle is absolutely perfect, because it's not.
We're all works in progress, right? And so you don't have to be perfect to have the highest quality of life. Not everything is our fault, but we've got to do what we can do in order to make the most out of this, right? I,
Absolutely.
I like that you use humor at every turn. Did you say it was fun? You're
Yeah,
awesome.
you have to. I do I look at this disease as a blessing. And
Ah,
I know that's kind of odd for some. Wait, what?
right.
Because of my diagnosis, I was able to get my life in order. Whenever I left the hospital 5 days after I was diagnosed, I went home and went, okay, I got to change my lifestyle now. I was young. I was 23. I know you're adding up 23 and 30. Ugh.
You're looking
But
good. You're looking great.
I did everything I possibly could to make my lifestyle as good as possible. And I already had a degree. So now I went back to school because I love doing this so much and living this healthy lifestyle. I went back to school to become a dietitian. So this has been I call this disease, oddly enough, my blessing, because it was my opportunity to change my lifestyle and to improve and to live the highest quality of life I possibly could.
What an inspiration. Thanks, Julie.
All right, so blood sugar levels, what is considered normal? Oh, my mom used to say the normal is a setting on a washing machine. Nothing in life is normal. So we have normal ranges, and really anything less than 100 when you're first waking up. So let's say you've slept for 8 hours, hopefully. So you first wake up in the morning and you test your blood sugar, prick your fingers and test your blood sugar. Less than 100 is considered normal. And that's because you haven't eaten for at least 8 hours. And when your doctor tests a blood sugar, they usually say, I want a fasting blood sugar. That means you don't eat anything and haven't had anything to eat, usually since midnight the night before, or at least 8 hours. And then it should be 100. Now we count this as milligrams per deciliter. I know, and that whole decimal system, the metric system. So we count it as milligrams per deciliter. So I may not always say milligrams per deciliter, but I will say, less than 100. And that is a good number. If it's less than 100 and you do not have diabetes, then that's not a diagnosis. But over 100, it may be a diagnosis of what's called prediabetes, or it may be a diagnosis of diabetes if it's higher than 126. Now your postprandial means after a meal. And we want this blood sugar checked 2 hours after the start of a meal, 2 hours after your first bite. Now for me, it doesn't take, I'm a fast eater, I know, but some people eat very slowly, right? So if it takes them 30 minutes to eat, we don't want them testing their blood sugar right after they've eaten, because some of that carbohydrate that they've consumed is already starting to work in their body to raise blood sugar levels. So after that first bite, look at the clock, and 2 hours later, that is your 2 hour or your postprandial blood sugar levels. And the reason we say 2 hours is because at 2 hours, really, that's about the highest or the peak of your blood sugar level, especially if you've had some carbohydrates in that meal. We want that number less than 140. That's a really good number. 140 means that that is well controlled, and that really decreases the risk of some complications when it is less than 140 after a meal. Hard to do after certain meals, but we'll talk more about that when we talk about healthy eating. So make sure you check into the healthy eating one. Now, hemoglobin A1C, like I said before, that was an average of what your blood sugars have been over the last 3 months. It's usually in a percentage. So normal is 5.7%. That means blood sugars are averaging around 115, give or take. For most people, an A1C though of about 6%, which we may see, or 6.5%, means that blood sugars are averaging a little bit higher, but they're still pretty good. Now let's look at what the glucose level or the blood sugar level is and what that means. So in this slide, I have just a little view of blood glucose or blood sugar. These big red dots, this is your red blood cells. These little white dots, this is glucose or sugar molecules. So this would be normal. This is considered normal. There's not a lot of them. There's not very little. When there's hypoglycemia or low blood sugar, hypo meaning low blood sugar, there's very little or almost no sometimes glucose molecules in the blood. So your red blood cells are here, and then your little glucose molecule, only one of them. But when we have hyperglycemia, which most people with diabetes deal with, then we're going to have a lot more glucose molecules, and you see a lot more here. With your hemoglobin A1C, what they look at is your red blood cell. Those glucose molecules or those sugar molecules attach to the red blood cells. And when they start seeing, and you see there's a lot of glucose molecules here, when they start seeing all of these glucose molecules attaching to these red blood cells, that gives them an idea that blood sugar levels are high most of the time. So that gives that average that may be a little bit higher. As we look down to our goals down here, you see postprandial is 180. The previous slide, we said that postprandial was less than 140. That is a normal for somebody who does not have diabetes. Their blood sugar is not really going to rise higher than 140 after a meal, usually, unless they go somewhere like Olive Garden, ate a big old plate of pasta. It may still rise a little bit higher, but their pancreas is going to take care of it, and it's going to bring it back down to normal fairly quickly. So for somebody with diabetes, their pancreas isn't going to work as well. That insulin isn't going to work as well in the body. So blood sugar levels are going to go higher. So postprandial or after meal blood sugars is less than 180 is our goal, getting less than 180. It's difficult. I will tell you, my goal is less than 140, and sometimes it's hard to do. So we usually say for somebody, especially somebody who's newly diagnosed, let's try to keep it less than 180. It's more realistic, and it's a little easier to do than trying to keep it less than 140. For you to try to keep it less than 140 right now, unless you're not on medication, if you have pre-diabetes, for example, you're only controlling it with diet, that's fine. But if you're on medication, keeping it less than 140 can actually increase your risks for hypoglycemia or low blood sugar, and that can be really, really dangerous, and we don't want that to occur. Now, a hemoglobin A1C of less than 7% is your goal. That means that blood sugars are averaging around 154. So that's not terrible, and the goal is a less than 7%. So what is a low blood sugar? Because we just talked about low blood sugar and high blood sugar, hypoglycemia and hyperglycemia. So let's explain what that is exactly. That is a blood sugar that's less than 70. So there are some symptoms that go along with that. And if you've never had one, the first day you have it, you will do everything you can to avoid having it again. It's a very uncomfortable feeling. anxiety. You have a great, huge feeling of anxiety, shaky, sweaty, confused. There was a show, you've probably seen the show Bad Boys, Bad Boys, Bad Boys, what you gonna do, that show?
Yeah.
Well, they pulled over a man who was driving only about 25 miles per hour, and he was weaving all over the road. So they pulled him over. He got out of the car and he couldn't walk. He was all walking all over the place. Well, they charged him with DUI, though he did not have any alcohol. They got him back to the jail. His blood sugar was 34.
Oh, do
So
do everybody think,
very, very dangerous.
does
That
everybody
confused. He couldn't answer their questions. He was very confused. But it also makes you feel very anxious. One of the things that it does make you do, it makes you feel anxious. However, sometimes that anxiousness can translate into eating a lot of food to make yourself feel better. And that's called over treating, and that can lead to a high blood sugar. So we'll talk a little bit more about treatment later on. But understanding that a low blood sugar, though, can be very, very dangerous, especially if it's not treated quickly.
Julie, does everybody have symptoms of hypoglycemia?
No, there are some people who don't have any symptoms. I have what's called hypoglycemia unawareness. So my blood sugar can get down to 30 and I don't have any symptoms at all. And I could actually carry on the conversation perfectly normal. But it can lead to something horrible, especially if I get behind the wheel of a car. In the state of Virginia, you can lose your license for a period of time if an accident occurs because of a low blood sugar. So we have to be careful with those low blood sugars and what you're doing. It can cause somebody to fall down. Let's say you have a low blood sugar while walking down a step and you may not recognize the symptoms. So if you are normally shaky, if you're a nervous person, and I know some people who are, then that shakiness may just be normal. Or that headache that you may have every now and then may be normal, but those are symptoms of a low blood sugar. And we have to recognize what those symptoms are. A lot of times people do not have. I have hypoglycemia unawareness, but I wear an insulin pump with a sensor that alarms to tell me that my blood sugar is dropping and I need to treat it ASAP. Not everybody can get one of those. Not everybody has one of those, and not everybody can get one, at least not now. But eventually, most people will have those, and that would be phenomenal, but we still have to take care of it and prevent it as much as possible.
So for now, if somebody doesn't have a pump and they're just kind of feeling off or have any inkling that they might have low blood sugar, what should they do?
Prick a finger. Don't say, but I think my blood sugar is this, or I feel like my blood sugar is this. Raise your hand if you're a psychic. Yeah, none of us are, probably. Maybe one or two of you might be, but usually your blood sugar can change at any point in time. There are 86,400 seconds in a day.
Ooh, that's pretty good.
So at any point in time, because of what you've eaten, because of exercise, because of stress, because of a phone call you just had, because of depression, because of lack of sleep, blood sugar levels can change all throughout the day. So you don't have to test it every second of the day, but anytime you are feeling low, it is extremely important to prick a finger just to see what it is. And if it's 100, then okay, that shakiness was just simply because I'm a nervous person and it's what I am. But don't always count on that. Don't always count on it. Always prick a finger. I test my blood sugar, even though I wear a sensor, I test my blood sugar about 8 to 12 times a day, depending. So I'm not going to be a hand model. I've already come to that conclusion. Not a goal in my life. So I don't mind pricking a finger, and I'll do it every time if I am not sure what it is. Even though my sensor may tell me what it is, sometimes I prefer to test it to get an actual result.
Okay.
These are some of the more symptoms of low blood sugar. Headache is a symptom of low blood sugar, and sometimes that may be the only symptom you get. The most common are shaky, anxiety, sweaty are the most common. But you may get blurred vision. You may have some tiredness, fatigue is some of the feelings. So don't always count that, oh, I'm just tired, that's why I'm fatigued. If you also notice that you can't think well, so remember that the confusion was a symptom, that then usually by the time that confusion comes around, it's pretty low by that point, and you really need to treat it as soon as possible. So what is high blood sugar? High blood sugar is also known as hyperglycemia. Hyper being high or rising. This is a blood sugar that's greater than 180. For most people who don't have diabetes, a high blood sugar would be greater than 140. But for people who have diabetes, what's really considered is greater than 180. Remember that 2-hour postprandial? We don't want it higher than 180 because now we're starting to get into the hyperglycemia at that point. So some of the symptoms are, and you may have experienced this if you were diagnosed with a high blood sugar, is thirsty. Oh, have to go to the bathroom often. When I was diagnosed, the day before I was diagnosed, I was drinking water, and I literally sat in the bathroom. And that night before I went to the doctor, I slept in the bathroom because I kept having to get up and go to the bathroom. Eventually, I was just pouring the water down the toilet to alleviate the middleman. It was just crazy with how much water I was drinking. Your mouth gets very, very dry, and you drink water to treat that, number one, but your body also needs that water. It wants to get rid of some of that extra glucose in the body, and that water is going to help to send some of it out via your kidneys or your urine, but not all of it's going to go that way. So you can't count on drinking water as a treatment. Blurry vision can affect it, and headache. Oh, now remember, headache, blurry vision, these are also symptoms of low blood sugar. So that can mean, well, gosh, I don't know if my blood sugar is high or low. Prick a finger to see what it is, because you have to know what it is.
Julie, oh,
Go
I'm
ahead.
sorry. Some people are never less than 180. And so, tell us about the highest, and maybe when we're really getting into an emergency number, what is the number that would be the highest before we should reach out to that physician?
When it's consistently over 400. If it's every single day when you wake up in the morning over 400, or in the afternoon, it's consistently over 400, then that's a phone call. That needs to be a phone call to your physician to talk about what can be done. There may need to be an adjustment of medication, or maybe even to start medication. And don't think, well, I don't want to start medication. I feel fine at 400. The reason that you may feel fine at 400 is because that's where you've been. Your body's become used to it. But the damage is being done and leading to some potential complications. So we don't want to get to that point. We want to make sure that your blood glucose levels, your blood sugar levels are as normal as possible. As your blood sugar levels start to drop and start to come down to normal, you may start to feel those symptoms, though, of hypoglycemia, only because your body is not used to being there, though you're not considered low blood sugar or hypoglycemic. So if, let's say, your blood sugar gets down to 150, and then now you're starting to have those feelings of low blood sugar, doesn't mean your blood sugar is low. It's just your body is not used to being that low. So your body thinks that it's a low blood sugar. But high blood sugars really should be taken care of. Phone call immediately. If you start having some symptoms, though, of some of the more severe symptoms like gastrointestinal upset, when the blood sugars are high, nausea and vomiting, that may be emergency room treatment. And we'll talk more about that later on.
Okay.
So some of the symptoms, yes, it is the extreme thirst, cannot get enough water in, the mouth is dry. But it is, again, your body trying to also wanting to get rid of. Your body becomes very dehydrated with that high blood sugar in your blood. Bedwetting. So not being able to get up to go to the bathroom. Remember, also fatigue and lethargy or you're very lethargic, you're very fatigued, is also a part of high blood sugars. The day that I was diagnosed, I laid on the couch the morning before I went to the doctor. I was laying on the couch. My roommate said goodbye to me 5 times before I responded to her. I was so tired. My blood sugar was so high. It was 560 when I was diagnosed. It was so high that I didn't even recognize. I was so tired and fatigued and lethargic and laying on the couch that I did not even hear her say goodbye to me 5 times before I even recognized it. So, it can be very, very tired, so tired to not get up in the middle of the night and go to the bathroom. And that's something to think about too. If you are having to get up a lot during the night to go to the bathroom, test the blood sugar. Your blood sugars may be higher overnight too.